Hi everyone, welcome to ResearchMD.com. This is Dr. Pramil Chariat. I work as a Chief Medical Officer in the United States. So we've been doing series of videos on physician mistakes. Okay, the impact of physician mistakes are huge. One, it put an emotional toll on our system. It also can have financial impact. Is also huge, right? And the lawyers can come after us, and all of your hard-earned money could be gone in a second. So be careful. A lot of times, if you know the most important thing where people usually make mistakes, and if you pay extra attention, you could prevent it. Okay, that's the whole purpose of this talks. Okay. Again, so this happened. There was a patient came in and had fever, altered mental status, and neck stiffness. But the physician thought it was influenza. And by the time they diagnosed the meningitis, it was late, and the patient ended up having a lot of complications. Okay, so be careful when somebody have a meningitis, and in this particular case, they end up paying $27 million to the patient's family. Okay, so let's look at a little bit about bacterial meningitis, or any type of meningitis. Again, is deadly. Mortality rate is extremely high. Okay, so the classic triad of the symptoms usually is fever, neck stiffness, altered mental status. 99% of the time, your diagnosis is right. This is meningitis. Okay. So again, fever, altered mental status, and neck stiffness. Okay, if you find that a patient, you need to rule out is meningitis. Okay, so what are the other symptoms? Again, we talk about sudden high fever, stiff neck, severe headache, nausea, vomiting, confusion, seizure, photophobia, and skin rash. Those are the other symptoms you can find. So how do you diagnose it? Again, this is the patient, you need an LP. And then this need to be, the first thing you have to do, again, you start with the antibiotic, okay? Don't wait for the results to come back, because the time is essential here. The more you wait, there's a lot of complications, including deafness, so many things. So the first thing to do is, like, if you're suspecting, you can send for an LP if you could do it right away, but don't delay the antibiotic. It's better to cover with for bacterial and viral. Acyclovir is important until you rule out it's not viral meningitis, okay? So the treatment, again, blood test, lumbar puncture, CT scan or MRI is not going to show you anything. Maybe initial, you can do a CT to make sure there's no bleeding in the brain and all of this kind of thing, but it's not very useful. People think the mistake they can usually make is they get a CT and MRI, everything goes fine, and they assume it's something else. Okay, an MRI, maybe some meningeal inflammation might be seen, but it's not very specific. Again, the test is lumbar puncture. If you're suspecting any of that, maybe you can do it, you don't need a CT to make sure everything is okay in the brain, but better to get lumbar puncture done right away and then send the results out, okay? And the treatment, again, you start with antibiotics and always cover for the viral, give a acyclovir IV, and then if you're suspecting fungal, you can give that. Again, corticosteroid bacterial meningitis is shown to be very beneficial, but you have to start this right away, okay? Pain relievers and IV fluids. Again, look at what are the complications. You can have hearing loss, recurrent seizures, brain damage, paralysis, vision loss, and memory problems. Again, they could have long-lasting brain damage, okay? Long-lasting brain damage. Again, be careful. Meningitis, we talk about, people usually miss it because they don't pay much attention to it, but always, anytime somebody with a headache, fever, neck stiffness, altered mental status, your diagnosis, it's your job to rule out it's not meningitis. Get an LP, my friend. Otherwise, money is going to be gone. In this case, 27 million. I don't know if you have that much money in the bank. I don't have it. So pay attention to small details like this where you can make mistakes, okay? Who cares about the urinary tract infection, pneumonia, where usually everybody will be able to treat. But this, if you don't pay attention, your money is going to be gone. Money gone, no honey, your wife is going to leave. Just be careful, my friends, okay? If any questions, please put it under comments. And if you think anything we could tell the others, any mistake you made, we could learn from, please put it under the comments so we can make a presentation and save a lot of lives and also keep the money. Okay, thank you so much for watching. God bless, and please subscribe to our channel. Thank you again, my friends. Take care.